The future is here. The new age of healthcare is now. Regenerative medicine is a revolutionary field involving the engineering of cells and other biomaterials for the purpose of preserving, restoring, or enhancing organ function. The medical city is at the forefront of this revolution.
Regenerative medicine offers us a new way of understanding and maintaining health. Over time, the body's cells are damaged by factors such as genetics, environment, trauma, disease, and even aging. This damage impairs organ function and compromises quality of life. Conventional medicine makes use of synthetic products and chemicals and invasive procedures such as surgery to treat disease. As practiced in the medical city, regenerative medicine works with the patient's own cells. Often pursued together with conventional medicine, we repair cell damage while also addressing the root causes of the damage itself.
Regenerative medicine therapies provide unprecedented opportunities to respond to debilitating diseases for which there are few known or no cures.
To date, we've had some success in treating certain forms of cancer, particularly when working in conjunction with standard modes of treatment, such as chemotherapy and radiation therapy. We have been able to shrink the cancer itself, as well as repair tissue damage by the toxic therapies. We're also developing treatments to restore brain, kidney, heart, and pancreatic function, to address major illnesses such as Parkinson's disease and Alzheimer's disease, kidney failure, cardiomyopathy, diabetes, osteoarthritis, and rheumatoid arthritis. Regenerative medicine has also been successfully applied in the management of burns, strokes, spinal cord injuries, and detached retinas.
Regenerative medicine aims not only to help patients who are already ill, but also to prevent the onslaught of disease. Thus, applications in the areas of wellness and aesthetic medicine are important priorities.
While providing our patients with regenerative medicine treatments, we found that over time, they were looking healthier and even physically more attractive. This gave us the confidence to extend our service offerings to wellness and aesthetics.
Regenerative medicine's innovative therapies harness the body's ability to heal itself. The key lies in a cell that is primitive and undifferentiated, but holds infinite promise precisely because of its primal nature, the stem cell.
Stem cells are master cells that can be developed into any one of the body's 200 cell types or be sensitized to attack diseased cells, including malignant tumors. They can replicate themselves many times over and theoretically do so without limit. When reintroduced into the patient, stem cells have the special ability to home in onto their target and work their healing magic.
Employing the unique properties of stem cells, the Medical City's Regenerative Medicine program offers a full complement of therapies that address wellness and illness at the molecular level.
What we have discovered is that with the right process, using the right levels of electrical stimulation and the right substances in the right amounts, we can turn non-specific or undifferentiated cells into ones with highly specialized functions. We are real pioneers here. Patients come to us from all over the country, from all over the world, to access our distinct range of regenerative medicine services. Stem cell transplants involve the infusion of cells that have been processed and coaxed to develop cells of a specific organ or tissue type. We do two types of stem cell transplants. we transplant processed stromal cells, generally harvested from the bone marrow, to preserve, repair, or enhance functions of the target organ. Hematopoietic stem cell transplants restore the blood and immune systems. Another class of regenerative medicine treatments involves adaptive immunotherapy. These therapies activate the body's own immune system to fight cancer or treat various autoimmune diseases. Dendritic cell therapy employs specialized immune cells found in the bloodstream to treat cancer. The dendritic cells are primed to recognize the patient's own cancer cells, and a vaccine is produced that seeks out these cancer cells and destroys them. This intervention carries much less toxicity compared to other treatments, such as chemotherapy or radiation, and works with the body's innate ability to fight the invasion of mutant cells. However, the immune cell therapy can be used together with chemotherapy or radiation to enhance its effectiveness and decrease toxicity. Marrow stromal cell therapy, the second type of adaptive immunotherapy, modulates the immune response in the treatment of diseases such as lupus, rheumatoid arthritis, and other autoimmune disorders.
Regenerative medicine therapies entail complex processes of cell extraction, cultivation, and transformation, performed under very controlled laboratory conditions.
The first step of treatment involves collection of the stem cells. There are 4 sources of stem cells: embryos, aborted fetuses, umbilical cords, and the patient's own cells. In the medical city, we use only adult stem cells of the patient and those from the umbilical cord. For cancer patients, stem cells are collected through a process called leukapheresis, where a highly sophisticated computerized machine separates and collects the stem cells from other cells in the patient's bloodstream. In contrast, for non-cancer conditions, we usually collect the stem cells by bone marrow aspiration. So even the collection process is personalized and customized according to the patient's specific needs. We also have a very unique umbilical cord collection service. While other centers collect only the cord blood, we collect, process, expand, and store all useful components of the umbilical cord. From these, we are able to secure the ingredients for many different types of cells: brain, heart, lungs, eyes, skin, and so on. On the other hand, cells from umbilical cord blood can only be used to make blood cells. The second step is induction, where we prime the cells to grow and respond to the corresponding maturation factors. In the third step, activation, we introduce factors which prepare the cell to function in the specialized manner we intend. Sensitization is the fourth step. Here, we train the cells to recognize the presence of specific molecules in the target area and to perform the desired action. For example, in the case of dendritic cells, it is during this stage that they become able to differentiate and attack the patient's cancer cells. The fifth step is administration or infusion, where the processed cells are reintroduced into the body as repair agents. For cancer patients, we inject the cells right under the skin so that they are able to transmit special anti-cancer signals to the other live cells of the immune system also present under the skin. For patients needing organ regeneration, cells are injected intravenously, and they home in to the diseased organ as they were engineered to do. Finally, the patient's response to treatment protocols is closely monitored, evaluated, and documented.
The Medical City's brand of regenerative medicine requires a multidisciplinary team approach to service development and delivery. It is the synergy of the team that spurs the discovery and innovation that defines regenerative medicine.
In the Medical City, our patient care teams are composed of physicians from various specialized and subspecialized fields of medicine. Through our partnership with the Ateneo School of Science and Engineering, we also engage basic scientists as integral members of the team, such as biologists, biochemists, chemists, physicists, mathematicians, and computer engineers. Together, we push the boundaries of medical research and application.
Regenerative medicine takes the Medical City's commitment to patient partnership to the next level. It expands in geometric terms with a range of options that patients can consider in achieving their personal health goals. More importantly, it represents the most personalized approach to patient care, addressing uniqueness at the most basic level, the level of the cell.
The one-size-fits-all approach to patient care does not work. At the heart of regenerative medicine in the Medical City is a recognition of each person's uniqueness and the design of a full response to that uniqueness. From the very macro perspective of one's personal circumstances and lifestyle choices to the most micro perspective of genetic and molecular makeup. We are truly a leader in this field. We have served a great number of patients from here and abroad. By far, we have the largest scale of operations, and we offer the broadest range of services in the country.
The human body's potential to heal itself is near limitless. As we progress in our understanding of the magic and miracle of cells, we will continue to expand and enhance our repertoire of regenerative medicine applications. The future of healthcare is in each one of us. Through the Medical City's Regenerative Medicine program, the future is here and now.